So yesterday what topic completed? What topic left? So we are for autopsy, right? Okay, thank you. So autopsy, necropsy, postmortem. Autopsy, necropsy, postmortem. Both are same. All terms are same only. Autopsy, necropsy, postmortem. Okay. So while coming in this uh, autopsy, necropsy, postmortem, how they are doing? That one is how doing. So they are seeing through eye and giving the result. It is for gross examination only. Seeing through eye and giving the result. It is for gross examination. Seeing through eye and with microscope, it is the gross and microscope. Only looking through eye and giving the result is gross. Seeing through eye and looking in microscope, it is for gross and microscope. Then limited. Limited means they are not examining full. They are examining the particular gland, organ, area, region alone. Particular gland, organ, area, region alone, it is for limited. So limited gross and microscope. In that particular gland, organ and all, it is a single organ. Area, trunk, like that, any one specified area they are looking and giving the result, it is for limited. So we have gross examination, gross and microscope, limited, forensic, and last forensic. Forensic mean based on the evidence, fingerprints or what other evidence present. Based on that, concluding the postmortem. Fingerprints or some other evidences basis, they are concluding the postmortem report. It is for forensic. Then coroner's call as per court order to find the cause of death. As per court order. As per court order to find the cause of death. That is for coroner's call. Only gross and microscope, limited, forensic, coroner's call. As per court order to find the cause of death. That is the coroner's call. The gross and microscope, limited gross and microscope, forensic, and coroner's call. Okay, please go and check these codes inside the book, everyone. Okay, here postmortem seeing through eye and giving now it is a gross. Seeing through eye and with microscope, gross and microscope. Then limited now they are not examining full. particular gland, organ, area, region alone doing, it is for limited Gaussian microscope. Then forensic. Forensic means based on the evidence. What evidence present in that basis doing now. It is for forensic. Coroner's call as per court order to find the cause of death. As per court order to find the cause of death. That is a coroner's call. Okay. So please go through this. In that basis, I am giving 3 questions. Okay. So please check these 3 question answers. Okay, I'm giving the answers for this. Second. Please cross check. Okay, everyone clear, right? First one is gunshot wound in chest. Cross an examination of the upper part of the trunk. So W036. Then cross and microscopic examination of the heart. W037. Then infants with brain. W028. Okay, everyone clear? Any doubts?
Sir, can you explain the first question?
First question, trunk. Trunk is the what? It is the full part or only region? Like that you have to think.
No. Okay. Full body means what could we have to take,
Cross
sir?
and microscope. Not limited.
Okay. Okay, sir.
So one limited
Without
code is
CNS,
there.
right?
Yeah, yeah. One is for
Without CNS means what? Like
central nervous
what's the
system.
meaning?
That is.
Okay.
So what will come in
So
central
whole
nervous? Yeah.
like brain.
Yes.
Okay. So one doubt, sir. Like full body means brain also they determine like they will examine, right?
Yeah. In that they are examining, but if we have the code, they are not examining brain without CNS and with the CNS.
Okay.
That central nervous system full they are doing now on code without now on code. Only specifying brain and spinal cord now on code and like that we are separately in that.
Okay. Okay. Okay, sir.
So they
Then for
are not telling
forensic
any
means
based on the evidence, maybe fingerprints or some other uh, evidences available. Based on that, they are concluding the postmortem.
okay.
Okay. Second one only heart. Heart means single organ. Then last one direct. I shared notes already. Given. Okay, next for the pathology consultation. Consultation mean one doctor or one pathologist asking the other pathologist. They are doing surgery and taking the sample. That sample sending to the other pathologist office for to find out the abnormalities of the sample. Okay, that is the surgical pathology outside. Outside mean who's going to do consultation on that material, that pathologist receiving sample from the outside. Pathologist receiving sample from outside. That's why it is outside consultation. During surgery, surgeon called to the pathologist. Pathologist came into the operating room. He taken the specimen and looking and giving the result is in intraoperative consultation. While doing surgery, surgeon called to the pathologist. Pathologist coming into the operating room. He taken the specimen and is giving the results mean intraoperative. Outside mean already done surgery, taken the specimen. That specimen received from outside, maybe from the surgeon or from other pathologist office. That is for outside. In that clinical pathology 80500 and 502, these codes are deleted. So no need of that. Code deleted, leave it. We have surgical pathology in that outside and intraoperative only we have the codes. So outside consultation 88321, 88323, 88325. 88321, 323, 325. Please go and check these codes inside the book. Everyone, please go and check what page number this codes present.
Six nine one.
Okay, 691. Please go there, everyone. So 88321. That is for that sample receiving from outside. Already slide prepared specimen receiving. Already slide prepared specimen receiving is going to do consultation on that material. It is for 88321. Slide prepared elsewhere. Slide preparation means they will keep the one mirror in that they will take the sample, made it to small pieces, then see with the microscope. That is the slide preparation. So slide prepared specimen, slide prepared sample, slide prepared tissues receiving. Then you have to go for the code 88321. Okay. So 88323 is there. Need to prepare the slide. Need to prepare the slide. Slide prepared elsewhere 88321. Need to prepare slide 88323. Only raw sample received. Need to do consolation on that material. That is for the 88323. Slide prepared material receiving from outside itself. They slide prepared that sample sending na 88321. Okay, so you need to know that clearly. Okay, 88321, 323. And 325 is along with is reviewing the patient history, medical record, and specimen 88325. Along with that, he reviewing the patient medical record, specimen, and history, everything na 88325. Only raw sample slide prepared specimen receiving. In that going to do consolation mean 88321. Need to prepare slide mean 88323. Along with is reviewing the patient history, medical record, and specimen 88325. So 88321, 323, 325. You need to know that clearly. Okay. Then intraoperative consultation. During surgery, surgeon made call to the pathologist. Pathologist came into operating room. Then what he is doing? He is taking the sample and looking through eye and giving the result. It is for cross examination. Cross examination. Seeing through eye and giving the result is cross. And he taken the sample and he made into small pieces. Then he is looking. Taken sample, that sample made into small pieces, and looking the findings mean it is the tissue block examination. Initial tissue block AA331. Each additional tissue block AA332. Only through eye means first code, and taken the sample made into small pieces and giving the result mean AA331, AA332. And they are looking only, that pathologist looking only cells of that initial cytological examination, each additional cytological examination. Initial and additional. Initial, additional. Okay, so we have to check in that intraoperative what? Only cross or tissue block or cytological examination. So in that cytological, initial is W333, additional is W334. Suppose if I'm asking question 4, 4 tissue block examination, intraoperative consultation. What is the answer? 4 tissue block examination.
AA331, AA332 into 3.
Yes, correct. W331, W332 into 3. Yes. And if I'm asking for cytological examination, for cytological examination, W333, W334 into 3. W333, W334 into 3. Okay, yes, correct. Suppose one encounter at a time, tissue block and cytological examination both coming. Tissue block and cytological examination both coming. Tissue block plus cytological examination both coming. Tissue block primary code, add-on code, cytological examination add-on code. tissue block primary code, add-on code, and cytological examination add-on code. Okay, so you need to check correctly that tissue block and cytological examination both coming. Tissue block primary code, add-on code, cytological examination add-on code. Okay, so you need to know this. If I'm asking 4 tissue block and 4 cytological examination done at a time, 4 tissue block, 4 cytological examination done, what is the answer? So tissue block and cytological examination coming. First you have to give tissue block primary code, add-on code, cytological examination add-on code. Okay. So double A double three one, double A double three two into 3, then double double three 4 into 4. Yes, correct. Like this you have to take. Okay. Everyone clear? Okay, this much only. 8 series. So panel coding, evocative, drug testing, surgical pathology consultation. But I given some direct questions also, 6 questions. From here and all questions will come. Okay. Much only 8 series.